So, because we are in sympathetic overdrive by nighttime, if the kids are not resting well, they're not getting good quality sleep, so they are tired by day. But often children don't show tiredness as how adults show tiredness. They show it more by being wired.
Yes.
And because they're wired, now you've taken a tired brain and said, now wake up early, go to school, get in your 8 hours of schooling and then an after school club and then, all of that. They are showing ADD, ADHD like behaviors. So we have excellent research on this. There is no doubt about the fact that both these diseases of sleep disordered breathing as well as ADHD are very intimately connected.
Yes.
And we have research which actually says that more than 50% of ADHD could be misdiagnosed. It may actually just be a sleep breathing disorder.
Every child these days need braces. But now it makes sense what you're saying, because the jaw development is not shaped up correctly. That's why it's like a must-do thing. Oh, if you're a teenager, once you're 12, 13, every child has to go through the procedure of braces and everything. But it makes sense because the foundation has not been set.
But facial growth of the jaw bones is complete by age 12, 90% complete by age 12. With the snoring in children, very big red flag. Okay, extremely unhealthy for them. While the first 8 years of life is when the brain is very actively growing. And if you're snoring during that time, your oxygenation to the brain is poor, and therefore it is not developing in the same way. Now, I know I am not saying small things. These are very, very heavy things.
Yeah.
I put this out there because the research is very, very clear. There is many studies that show that snoring in your younger years of life for more than 6 months is going to change how the brain grows. So there's different parts of the brain, the cortex, the prefrontal lobe, and they'll show changes. There are other studies done on 11,000 children out of a government study in Sweden, which showed that children who snored at the age of 2 for more than 6 months had different learning capabilities at ages 6 and 8.
Wow.
So they actually needed more assisted learning around that. So fine, your child is doing well at school, everything's okay, but they're not thriving. They're not living to the best of their ability because they're not breathing well when they're sleeping. So snoring in children is a big red flag, and it should be treated with urgency, with whatever is needed to be resolved around it.
Welcome to Heal with Zainab, space where we come home to ourselves. This is Zainab, and here we explore what it truly means to be well, not only in your body, but also in mind and soul. Today's episode is very interesting for various reasons. One is that we have a very special guest, Dr. Tina Rokadia, who is prosthodontist for 18 years, and her specialization is airway dentistry, which is a very overlooked topic. We don't talk about it often, but it has a great impact. So basically, she is bridging the gap between our overall health of our body with dentistry. And second, why it's interesting, because coincidentally, we are twinning. Dr. Tina, welcome to my podcast.
Thank you so much, Zainab. Yeah, it's quite a coincidence that we are twinning, hopefully in thought and mindset as well today.
Yes, it's interesting because even the combination is so similar, because it usually doesn't happen, right? Yeah. But I like it. I like this kind of, twinnings that we do it coincidentally. So, I don't think many people, first of all, they know what is airway dentistry. Even I wasn't very familiar with it. And if I'm not wrong, there are not many airway dentists, at least in UAE and back home. I feel so.
Right. So, if we looked at the traditional way of dividing dentistry up, airway is not like a part, or it's not a separate specialty. It's not like, you have a root canal specialist or an orthodontist or a pediatric. There is no separate subspecialty called airway. But what airway needs to be is it actually needs to be a part of all our discussions. It needs to be a part of every dentist kind of looking at it as it. So we call it like airway first, or, airway centered dentistry or airway focused dentistry. Yes, the tag airway dentist kind of picked up somewhere along the line, but it's not that what I do is just airway dentistry. It is just the idea that whatever I do, I look at the airway first and put that at the forefront of.
So you like that functional approach, because I feel that's what I really like about you. Because usually mainstream doctors, dentistry, they don't focus on the functional part, the way, what is the root cause, right? And because here we really talk about this authentic treatments and all. Okay, like, you cannot suppress a symptom or something. Where is actually this problem is coming from, right? So what exactly is airway dentistry for people who do not know what is airways?
Right. So what we are seeing right now globally is that there are many challenges with breathing and breathing during sleep. Now, this is becoming a global phenomenon, and it's increasing in its propensity. And what we realized a little late to the game, honestly, is that ENTs as well as dentists, speech therapists have an ability to influence the breathing space. How we take air in, how we breathe it out, especially when we're sleeping, is very intimately connected to our jaws. So I would say airway dentistry is a specialty or a way of looking at the patient where we are looking at how is the jaw growth, how is the muscle function, the tongue and the cheeks and the lips, and therefore how does the patient breathe, and can the treatments we do improve that, or can the treatments we do give it a detrimental effect? So simply, airway dentistry would be looking also at how children as well as adults breathe by day during sleep, and looking at jaw growth to help that.
And how, like you said, it's not there in a conventional dentistry. So it's just like it was your choice after being practicing for so many years that, what made you inclined towards this particular topic?
So, we always say that airway dentistry generally is quite a rabbit hole. And once we fall in, it's been tricky. Most of us have been studying nonstop for a few more years. That's been my journey too. And invariably, these journeys come from personal stories. That's what starts the journey. And for me, I would say that I was a prosthodontist. Prosthodontist is something that's very different. We look at crowns, bridges, implants, more cosmetic dentistry. And it was going all right. I was a little bored. I'm not as aesthetically inclined in treatments as the city of Dubai is. And that made me start to look for answers around. Now, I had allergies and I was a mouth breather. And I was starting to hear this buzz around the idea that, hey, this is not healthy. It keeps you tired. Was definitely feeling all of that. And I started the first education during COVID. During COVID, it became very easy to access good education from the US, which was at that point, my kids were still younger. It was harder to leave them to travel. And as I started that, I suddenly realized that all of that dysfunction was there in my younger child, my son. And it really was very hard to see because it felt like the system had failed me, but I'm a dentist. So why had nobody pointed out these signs to me before that? I took that education, I put it aside for a little bit. Post-COVID, went back to practice and said, oh, wow, this is rampant. This is all my kids' friends. This is, my husband's friends who are snoring, my brother-in-law.
And we as parents, to be honest, we just consider it as a harmful habit. We don't know how serious it is.
Right. So that's what started the journey for me. My nasal allergies, my son's picky eating, a family member's snoring. It kind of just kept becoming different pockets of education that I kept adding up together till, and generally I'm a very in-depth person. I don't like to do things on the surface. And that led to a journey which has been just beautiful. It's been continuous, nonstop over the last 5 years, actually. And it's continues to grow and lead me in ways where I feel like there is maximum need for it.
But how, you just mentioned your son's picky eating. That is quite a surprise for me. You feel that breathing from mouth or inability to breathe properly during the night time, it can link to the picky eating or other issues like we are seeing in children like ADHD and anxiety and all of those?
Right. So I'll divide this into two aspects, one of muscle function and one of the aspects of coming out of mouth breathing. Okay. They're connected, but they can be slightly different as well. So my son had what we call a posterior tongue tie. So a tongue tie is when the string underneath your tongue is a little bit too tight, and this you're born with this, and that does not allow good movement of the tongue. And
so basically, when we touch the tip of the tongue to the roof, this part is basically
it's
that's called
tighter,
a string.
yeah. So it's not able to lift the tongue up as well. So posterior tongue tie, simply put, would be that the back or the middle of the tongue cannot lift up. And anterior tongue tie would be the front of the tongue can't lift up. Now, this is actually something that belongs to the range of dentistry, in the field of pediatric dentists mostly, but all dentists are taught about this. But it turns out that we are only taught about the very severe anterior tongue ties, where the child literally can't lift the front of their tongue up at all. And those are usually sorted out, well, not always, but often sorted out during infancy stages because they can't breastfeed, they can't talk well. But that is like a very severe end spectrum of the disease. There's a lot before that. And the posterior tongue ties are something that we're not taught about at all. So when you have this tongue, which is supposed to do so many roles in the mouth in terms of growth as well in terms of breathing, and it is tied down, it can't do its job, you're going to see funny symptoms come up. So, of course, difficulty breastfeeding or reflux, but then it comes to the stage of eating.
Sorry, so babies can also born with that?
Yes, tongue ties.
That's why they can't do breastfeeding.
That's right. So this is actually a little bit more known that tongue ties cause issues with breastfeeding, but my practice is filled with patients who have breastfed just fine for a couple of years, in fact, and that is very much still possible with having a tongue tie. But then when we go to the toddler years, picky eating is another common sign that we see with tongue ties. And by picky eating, I know I've had 2 toddlers along the way, and I know that children can be very fussy with eating. But there's a certain pattern that I want to highlight. And that pattern of eating is when they're avoiding anything hard. By hard foods, I mean like things like raw carrots, nuts, a chunky piece of chicken or chicken off the bone or steak, things that actually needed chewing. And I'll step aside a little bit over here on the conversation, Zainab, to say that this is a global issue where post-industrial revolution, we learned how to grind our food, and everything is becoming softer and softer. It is melt in your mouth, processed, easy. So I always say, think about how this food originated in nature. And if you're not consuming it in that closest to that nature fashion, then something's wrong. So gradually our children can get away with getting nutrition, but not getting any chewing. And this is affecting jaw growth. But circling back to our tongue ties, these children who are not able to use the tongue efficiently are going to avoid that chewing. They're going to ask for textures that are softer, or they're going to pocket it or not want to chew.
And the common thing is that, it hurts, I can't.
Yeah, or they get tired in between the meal, so they stop the meals fast, or they ask for water or yogurt or a juice, depending on, which culture we come from, to soften that food down. And those were so that's where my son's picky eating was there, but there was also snoring. There was also snoring, which was a part of that. There was also very high risk of respiratory infections. So as I said, that the tongue actually affects breathing, eating, as well as growth of the jaws. So he was showing some issues with the breathing and the eating at that point. But if you'll allow me, Zainab, I'll circle back to how this ties in with mouth breathing, coming to your question around ADHD. So let's say that we have this weak tongue. And the weak tongue in some children has affected the closure of the mouth. So the mouth is not able to stay closed. There could be many reasons for this. A weak tongue is one. Another could be that the tonsils and the adenoids grew very large. We can come to that again later, but it is a relatively common problem in certain environments as well. So for whatever reason, if we are mouth breathing, I want to highlight that this is not normal and it is not healthy. You asked me why, why is mouth breathing of any concern? So, mouth breathing is not the way we were supposed to breathe. It is sort of an emergency breathing method. So, let's think of caveman, many generations ago, he was nasal breathing and then he suddenly saw a tiger attacking him. So, now this man has to switch on the part of his brain which is for fight or flight, right? We're like, we are in emergency, so please escape. And that is when one is supposed to mouth breathe. So, through evolution, mouth breathing sends us more into a fight or flight response. Now, our body is so clever. It's amazing how it's designed, right? So we have something that we call our nervous system that we can't control. It's our autonomic nervous system. It runs itself.
Yes.
And it's got two, a sympathetic and a parasympathetic, right? So very simply, our sympathetic is the fight or flight.
Yes.
Get with it, adrenaline, cortisol, everything's flooding. And the other one is our rest and digest, the parasympathetic. And the rest and digest is all about vagal tone and relaxation and digestion and all of that. Guess which one we should be doing when we are sleeping?
Parasympathetic,
right?
Sure.
So we should be in our relaxed method to get our rest, for our brain to relax, as well as for our breathing to be perfect, so our digestion and the rest of our body can work okay. However, if we are mouth breathing while we are sleeping, now we are in sympathetic overdrive while we are sleeping. No wonder we are tired by day. This is one aspect of why mouth breathing is inefficient for...
And maybe one of the reason, I guess this is very, very common now in early teens and even in children, even if they sleep early at night, they want to sleep in the daytime. They want to sleep more. Like for them, rising early, if you're sleeping at 9 o'clock, 9:30, no, they don't want to. Let me sleep more because they are not taking a quality sleep.
That's right. So it's always, of course, quantity matters. But I think most of us have realized that, back in the day, there was this, when I grew up, I think I used to sleep the same 8 hours that my parents slept, right?
Yes.
We didn't know that children need more sleep.
Yes,
now, most of us do know that children
12 hours, it's weekend, let us sleep for more.
Right.
But might be because you are constantly in a sympathetic nervous system is activated while you're sleeping.
Right.
Yeah.
So your brain is not able to rest, but more importantly, mouth breathing also changes. Now we'll change the topic onto how mouth breathing changes the shape of your face when you're younger. Let's take a break here. I'll just go back to answering your question about the ADHD before that. So because we are in sympathetic overdrive by nighttime, if the kids are not resting well, they're not getting good quality sleep, so they are tired by day. But often children don't show tiredness as how adults show tiredness. They show it more by being wired.
Yes.
And because they are wired, now you've taken a tired brain and said, now wake up early, go to school, get in your 8 hours of schooling and then an after-school club and then, all of that. They are showing ADD, ADHD-like behaviors. So we have excellent research on this. There is no doubt about the fact that both these diseases of sleep disordered breathing as well as ADHD are very intimately connected.
Yes.
And we have research which actually says that more than 50% of ADHD could be misdiagnosed. It may actually just be a sleep breathing disorder. So we are really trying to put the word out there that before you label a child as having ADHD or worse, start medication for ADHD, it is really important that we not only screen for sleep, but we also treat their sleep because it's very, very interlinked.
Basically, it's stemming from stress, what I understood. Doesn't matter, is it a physical stress or a mental stress? So even if, you're right, if maybe it's a sleep stress,
right,
your body is not sleeping properly, it can lead to ADHD anyways.
Right. So when we say stress, as the common man, as all of us, we kind of think about it as like a psychological stress, right? But these are what we call physiological stressors, right? So yes, it is not your resting mode. It is a physiologically stressing your heart, stressing your brain into not being well rested. And therefore, you are going to act up by day. You're not going to be able to focus. Your impulse control is going to be lower because you have not slept well.
Oh, this is quite interesting and very, very informative, I'm sure, to many of the parents out there, because you're right, ADHD is like a flu now. Every other child is like, oh, he has ADHD, he's taking therapy and stuff. But yes, people are actually overlooking that what important role mouth breathing plays in it. And I think every other person I'm meeting now, mouth breather is a mouth breather, right? And I have been a mouth breather for, I don't know about now, I think I'm paying too much effort on it since recent years. What do you think about mouth taping, because that is also, again, they have different theories in it. Sometimes it works. I mean, sometimes I use it because my mouth is closed and all, but maybe in some cases it won't work.
So let's say that you have a fractured leg and you get these braces, right? And when you have like a knee sprain or something, and you have like a little supportive brace to wear on your leg. Now, if you are sitting in one place with your fractured leg, you might say, I've got this brace on and I'm just sitting and therefore it's okay. But if you're actually going to go on a hike and you are going to take your fractured leg and wear a brace on it, not like a cast, but just like an elastic brace, that is not going to help you and it's going to make things worse. So mouth taping is very similar in dysfunction. So if you have a mild sprain, so if you have just a mild muscular dysfunction because of which your mouth breathing, slight stuffiness in your nose, and you use some mouth tape, it may be okay. However, most mouth breathers that we see today have a lot of underlying dysfunction. We are closing the lips, but we are not looking at tongue position. We're not looking at the patency of the nose. So this can be actually quite harmful. And there are more and more studies coming out. How can it be harmful? Imagine you have a half open nose and now you're forcing your body to breathe through that. It may do it for a few hours, but this is causing cardiovascular dysfunction. So it's actually causing strain on your heart.
Because again, you're putting stress on.
Right. That's one. The second is, if you've not looked at tongue function, it's actually not helpful to close your lips. We need that tongue to be up in the roof of the mouth. When the tongue is up in the roof of the mouth, we get the best nose breathing possible. So if you've closed your lips, but nobody's evaluated you for tongue ties or for tongue position, then mouth taping is just... It's just, a Band-Aid on a much bigger problem, which occasionally can help and may not help others. I do advocate for mouth breathing every now and then, but it has to be once we have screened you, we have started some sort of treatment if there is a problem, right? So if you are heavily snoring, have sleep apnea, we have you in snoring appliances. If you're a child and there's a lot of muscle dysfunction, then we have you in myofunctional appliances. And in combination with that, we give you that little prop. And that little prop will be mouth taping.
Okay. And you also mentioned about changing of the jaws, right? Which is a very recent thing for me, because I know that my daughter is also struggling with that her whole jaw position has been changed. And of course, because you don't feel it because, the face is changing. So you don't realize till you actually get the x-rays done and scan that, there is something happening. So how it is dangerous and how exactly it happens? It happens due to the mouth breathing?
Right. So this we have actually known in dentistry for many decades, that if you don't sleep with your mouth closed, the face takes on a certain pattern. Now, why does this happen? This happens because the tongue has a very huge role in growing the upper jaw and the lower jaw. Where the tongue rests, it's a powerful organ. It's made of 8 muscles on each side, so 16 muscles. Every time we swallow, from the time of breastfeeding, moving on to a more mature swallow, the tongue pushes up against the palate and it grows our upper jaw into this wider forward position. And the lower jaw is then allowed to follow. Now, this is how man was supposed to grow. This is what we were supposed to
So how
look like.
actually we use these muscles? By chewing.
Correct.
That was our
Breastfeeding
natural.
and then
Breastfeeding
chewing.
and chewing. Okay.
Right. So we get a mature swallow with that, which then keeps that tongue resting up in the roof of the mouth at all times. So this grew our face wider and forward. Now, the front is the jaws, but the back is the airway. So that allowed the airway to also be of an adequate size. Now we took the tongue away. We made the tongue come down, because guess what? You can't breathe from your from your mouth. Sorry,
From your mouth, yeah.
You can't breathe from your nose.
Yes.
I'll repeat that. So guess what? You can't breathe from your nose if your tongue is up in the roof of your mouth. Okay. For you to be able to mouth breathe, your tongue has to be low down.
Yeah.
So you started mouth breathing. That meant your tongue was low down. As that tongue stayed down, the upper jaw did not grow as wide. The lower jaw tends to follow. So we start to see a variety of different what we call malocclusions or poor bites or poor jaw growth because of the muscles not doing their correct job. So I will really highlight that we have too much of an emphasis on genetics with relationship to malocclusions. We say that, oh, my parent looked this way. This is a gene, the weak lower jaw,
Yes,
the strong lower jaw, whatever. But I would say that yes, the genetics do have a place and the genetics do influence what goes wrong. But it is the environment that influences if something goes wrong. What I mean by that
What actually
is
can trigger that gene to activate.
correct.
Basically. Okay.
Correct. So malocclusion is majority not genetics. It is majority the environment. And what is the environment? The environment is breastfeeding, nasal breathing, no tonsil and adenoid growth into, creating nasal obstruction, hard chewing habits, tongue correct posture.
And
This
I guess
is
we
the
are not
environment.
doing anything.
Well,
Yes.
it's not necessarily our fault, Zainab. It is the society that we have created for ourselves.
Yes.
And it's important to, at this point, raise awareness and start changing habits. Woman to woman, I feel like we have moved away from so many traditional practices in the search for equality, in the search for, we women should be out there doing it
Yes,
all. And in
yes.
that, we've forgotten how evolution was shaped, how mankind, how our growth was shaped
Yes,
around certain
yes.
practices. Of course, the air is not clean. The gluten is not clean.
Every single thing. You're right. It's hard, but main thing is to be aware and talk about it, and whatever you can do as much as possible. You cannot, of course, completely change the society. You can't do that. But individually, what capacity you have to do it in your home, like we all are trying at least, right? And I feel that is one of the reasons. And I often used to ask that how come, and that's what made me question the dentist as well. I'm like, I know they are also, I'm sorry to say, but no, they are corrupt. They are also this, because how come when you go to any dentist, every child these days need braces? But now it makes sense what you're saying, because the jaw development is not shaped up correctly. That's why it's like a must-do thing. Oh, if you're a teenager, once you're 12, 13, every child has to go through the procedure of braces and everything. But it makes sense because the foundation has not been set. Yes.
So what we are learning now is that earlier traditionally braces used to start at age 12. That was the sort of advised time to see an orthodontist. It's been about, I want to say 10 or maybe, approximately 10 years that this guideline has been revised. And children are asked to see the orthodontist by age 7. And I am now of the belief that if we have not fixed before 6, we have a problem. So why are we going earlier and earlier on this front? It's because we're not looking at teeth. When we were talking about going to the orthodontist for straight teeth at age 12, it was only about looking at the teeth. But facial growth of the jaw bones is complete by age 12, 90% complete by age 12. So we don't have the ability to grow the jaw in different fashion if we have gone to the orthodontist at that point.
So after 12, you feel it's nearly impossible to reshape the jaws because it's now damage has been done.
Right.
Okay.
So we usually at that point have surgery or we are looking at teeth. Take it with a pinch of salt, because yes, we are continuing to work on reshaping the jaws and, all of that, even into like the 40s and the 50s. We're trying our best with working with that. But let's say that it's harder. It is harder to correct. So the better time to correct jaw growth is as early as we spot a problem, right? When we spot a problem, we know that something is off, not the teeth, but something in the muscular dysfunction is off.
So what suggestions you give to parents who have younger kids? Okay, like this is the symptoms, do not ignore. Like when you're saying spotting a problem, what are those problems?
Correct. So I would say do not ignore the symptoms of mouth breathing. So by daytime, mouth should be closed. Lips should be together. Whenever they are like watching TV, reading a book, playing on the iPad, doing some coloring. These are when you pick them up from school and you're looking at them in the rearview mirror. These are your opportunities to spot that their lips are actually closed at rest. That's during daytime. By nighttime, the main symptoms would also be an open mouth. But even with a closed mouth, we are looking at symptoms of noise. So sleep should be silent, which means that there is no snoring, no grinding, no heavy breathing heard outside of sickness. Sickness can be once every 3 or 4 months. It should not be more than that. Last one is that sleep should be restful. So they are not tossing and turning the whole night. Now, again, over here, a lot of families believe that it is normal for children to be very restless in their sleep. That is not true. Children, like adults, have
Actually, I
sleep
feel they
cycles.
should sleep more, like more sound sleep. Because,
Right. So it's about every 45
Yes.
minutes or
Yeah.
so that they would turn their side or so. But if they're rotating like a helicopter, or, parents have told me my child is like an octopus in the bed.
It's very common that, this child rotates. Like
That is not normal.
that's
There's
not
something
normal. Okay.
disturbing their breathing. And that when they wake up, let's say children after the age of 5, 4.5, depending on, this, do not need a nap by day. So if every time you take your car...
After the age of 5.
Yeah, they
Okay.
don't need a nap. Some of them stop at age 3, but they should be able to go through their day feeling fresh and happy. So every time you pick your child up from school, and if they need a nap in the car on the way home or to an activity, that is giving you a clue that... So these are a few of the prominent clues, I would say, that are, quite visible to a parent. Just go into their rooms after they go to sleep. I always tell all my families in the practice that make it a habit to go in and check on them before you go to bed. Just now, like, when you have the summer holidays and you're sharing rooms, etc.
Yes.
This whole separation of bed sharing has made us feel like, how do I know how my
How do
child
I-
sleeps? How am I
Exactly.
supposed to know? But we
Yes.
do need to keep a track on it a
Yes.
little bit and check out, at least for this, heavy breathing, mouth breathing, snoring, teeth grinding, very common.
Now
and
you're
very large
saying
red
it, and I
flags.
just realized that I used to do everything. Teeth grinding was very, very common when I was a child, like I think 11, 12 years old. But these are the things which I know my parents overlooked, or sometimes, these are or maybe there was not much awareness that, like she just grinds teeth.
Right.
They didn't know why, or nobody actually went to dentist to, even if they go, they're like, maybe she digestion issues or
Right.
something,
Yeah.
nobody actually figured out. Or her teeth is forward because my mom had it, so it's okay. There's so many things that we just overlooked. And especially mouth breathing as well. And snoring in our culture, not in our culture, I think globally, it's usually just make fun of. It's also not people don't take it seriously that, it has, like, once you cross 40 or 45, snoring is very common in old age. So
right.
it's
So let's
also a
touch
red
upon
flag,
snoring.
right?
Yeah. We'll divide the snoring into talking about snoring in children and then snoring in adults, if
Okay.
that's okay. With the snoring in children, very big red flag. Okay. Extremely unhealthy for them. While the first 8 years of life is when the brain is very actively growing. And if you're snoring during that time, your oxygenation to the brain is poor, and therefore it is not developing in the same way. Now, I know I am not saying small things. These are very, very heavy
very-
things
yes.
for a parent to hear who may be hearing me on this podcast. But I do find that it's essential that I put this out there because the research is very, very clear. There is many studies that show that snoring in your younger years of life for more than 6 months is going to change how the brain grows. So there's different parts of the brain, the cortex, the prefrontal lobe, and they'll show changes. There are other studies done on 11,000 children out of a government study in Sweden, which showed that children who snored at the age of 2 for more than 6 months had different learning capabilities at ages 6 and 8.
Wow.
So they actually needed more assisted learning around that. So fine, your child is doing well at school, everything's okay, but they're not thriving. They're not living to the best of their ability because they're not breathing well when they're sleeping. So snoring in children is a big red flag, and it should be treated with urgency, with whatever is needed to be resolved around it.
Okay.
All right. Snoring in adults.
Yes, how it is so different. Yeah.
So snoring in adults is often just a social joke, right?
Yeah.
From
Yes.
movies to everything, it's always a social joke. It is not normal at any age, but yes, it is very common. And yes, a little bit around the 50s, 60s, 70s, as the airway, like the rest of our body, as the muscle loses tone, it is more possible. But snoring is a sign of sleep apnea. Now, snoring can be there without the presence of sleep apnea, and you can have sleep apnea without the presence of snoring.
Before we then touch this topic, what exactly is sleep apnea? What happens in your body?
Right. So snoring is when you actually have, okay, let's cut that out and I'll get into what is sleep apnea itself.
Or you can tell both, because even snoring, like why it happens,
Right.
what is the obstruction there that we are producing that sound? Yeah.
Right. So snoring is a partial obstruction of the airway.
Okay.
It is that air wants to pass through the airway, like when we breathe in, and anything that is partially obstructing the space, air is getting turbulence in that process, and that causes the noise of snoring. So it could be coming just from our nose, it could be coming from enlarged tonsils or adenoids, even in adults, or it could be coming from the whole airway collapsing on itself. The tongue falling back into the airway, reducing the space in the airway, the muscles of the airway being relaxed and loose, which is normal during sleep, but yet the body should be able to keep it open enough for us to breathe. So this is snoring. Now, sleep apnea is a disease when you actually have complete obstruction of the airway for a few seconds at a time. So the medical community had to come up with a decision around what do we name as sleep apnea. So it is if you have complete or partial obstruction of the airway for up to 10 seconds at a time, that is called an apnea. Now we divided it. We said if into mild, moderate, and severe. So if you have up to 5 episodes an hour, then you are in the range of mild sleep apnea. Okay, 5 to 15 is mild sleep apnea. If you have,
and what happens in there, like if I'm sleeping and I'm unable to breathe for more than 10 seconds, I might just get panic and then wake up.
So various things can happen when you have these obstructions in your breathing. So the first thing that always happens is that your breathing changes. Sorry.
Yeah. Your breathing pattern maybe is
your
not-
heart rate. So
your heart rate changes. Okay.
So the first thing that always happens when you have a breathing disturbance is your heart rate changes. Your respiratory system and your cardiovascular system are intimately connected. So there are signs going on in your body to say, wake up, we are not being able to breathe, right? What could those signs be? You could be grinding. You'll be changing position. You'll be having what we call micro arousals or micro wake-ups. So you have restless sleep. And obviously, this is going to make you very tired.
Okay.
The other thing that happens is later in the disease, your oxygen drops. If you stop breathing for 10 seconds, 10 times every hour, your body is not able to retain the same level of oxygenation through the night.
Yeah.
This starts affecting a part of your brain that is responsible for waking you up. So a few years into the disease, this is a progressive disease. So let's say a decade or two of heavy snoring later, or mild sleep apnea becomes moderate sleep apnea because your body is not waking you up now. It is letting you progress through these breathing episodes. So instead of now 10 seconds, you stop your breathing for 15 seconds or 20 seconds.
And you're feeling okay that if you're not breathing within more than 10 seconds,
the brain doesn't wake you
you get
up.
immune to that.
Yeah.
Okay.
So while the snoring may come down, the sleep apnea rises and oxygenation drops. You start having more morning headaches. You start having to wake up to use the bathroom at night. And you get used to being tired. It just, I see this all the time in the practice where mostly the men who come into the practice are come with the chief complaint of, my wife sent me.
Yeah.
Right?
She's the one who is disturbed with your snoring.
Right. I am actually sleeping just fine, but my wife is disturbed, so I'm here to solve my snoring. And I take them through that discussion around how, whether you feel it or not, the sleep apnea is extremely harmful to your body. And they're like, okay, yes, let's solve this. So let's say we dentists solve it through something called a snoring appliance, a sleep apnea appliance. And when they come back for their follow-up a couple of months later, they're like, wow, I am sleeping really well now. I feel great. So I go back to the notes. And the notes never said that they were tired. When I asked them, they said, I feel fine. My wife is tired. So we discussed that. And they're like, yes, I did not know what good sleep meant till I actually have it. And that is true for all of us. We get used to being caffeinated. There are a lot of men who smoke just trying to figure out how to stay awake.
Yes.
There are people who have 6 to 8 cups of coffee or Diet Cokes by evening. So
they don't actually get to feel how they're feeling because you're suppressing that feeling all the time. Yeah.
Yeah.
Okay.
Yeah. So once you get good sleep, then you're like, how can I do without this? Right?
Yes.
Now I need to feel like this every morning. And then the good sleep is addictive rather than the other substances that we were just using as
Totally.
a
And you
crutch.
feel it's also linked with the high blood pressure or all this kind of chronic diseases?
So, sleep apnea has very clear research shown links to all sorts of cardiovascular diseases, in, hypertension, but also strokes. And it is actually a known marker for early death by approximately 10 years. It
That's
can
alarming.
Cut,
Oh
yes.
my God.
So sleep apnea should not go undetected and it should not go untreated. It also has connections with Alzheimer's and cognitive decline because it is basically causing microcirculation issues in your brain as well as in your heart. So this is extremely well known. The challenge is not about the practitioners. The challenge is not about the practitioners knowing this about sleep apnea.
Okay.
The challenge has become that the general public does not think that they need to get tested for sleep apnea. That snoring is not a problem. Snoring is common and hence it's okay. Snoring is the most common sign we have to show us that you should get tested for sleep apnea. Another common sign would be frequent wake-ups at night or feeling unrefreshed by mornings.
So basically, no matter which age you are in, you can be 70, 75, but that's when it gets way more common, right? Snoring and stuff. It's still, that means there is some obstruction in breathing, you are unable to breathe properly. It's still treatable, you feel. Doesn't matter the age.
It is, sleep apnea is a very treatable disease. Okay, it is not the easiest treatments. It often needs a combination of various things to come together. It's a disease that's progressive and therefore is complex, but it is treatable. It's not necessarily curable. And I'll make the difference between that.
Okay.
Most of the treatments that we have for sleep apnea kind of plug the hole at this point. Then the body changes, the disease changes, and then there needs to be a different sort of measure taken to it, which is why I am so passionate about treating the children. Is as I learned that, gosh, what a complex disease this is in adults. But now there is so little I can do outside of double jaw surgery to grow your airway.
Yeah.
And there is still so many different phenotypes that might still be causing sleep apnea.
So better
for
to
you.
start it from a very young age, yeah.
Right. So when we actually treat children, we are helping one phenotype of sleep apnea, which is the anatomy. So if the anatomy is large enough, then there is a lesser risk of collapse of that actual airway. If that is also narrow, with age, the other things are going to come in anyways. We are at risk of so many different things from the air we breathe to, weight. Weight is a big cause. And
So weight gain also can happen because of that.
It's dual linked. So weight gain causes sleep apnea and then sleep apnea causes weight gain. I would say that the link is more with weight gain causes sleep apnea. But how do you ask a tired person whose hormones are all over the place because they're not sleeping well to actually lose the weight or exercise? So you first actually have to treat the sleep apnea to some level and then go in to ask them to lose
So it's
some weight.
basically a cycle. I mean, either you're heavyweight or you don't have good sleep. One of the other things can get affected. So this is what I like about it, that the entire body is interconnected,
Yes.
which we often overlooked because we only target on this one area, but we don't understand that how everything is beautifully connected with everything. And coming to the, we're talking about adults here. I mean, I know there's a lot to talk about, but if there is three things or one thing that you would like to tell, what is a lifestyle that can help you, help your airways breathe better, or what is that one thing that we are doing completely wrong other than mouth breathing? Is there anything that you can say diet or breathing in a particular way? What are the top three things a person can do at home?
Wonderful. So I love that question because I'm all about the little things that one can do at home.
Yes.
I think we can all be much more aware of our breathing than we are presently. So in short, that would be nasal rinsing and becoming aware of our breathing by doing 5-7 minutes of a nasal breathing exercise every day. If I had to lengthen that, I would say that the air around us is not clean. And therefore, nasal rinsing is something that most of us need every now and then. We come in.
And when you say nasal rinsing, it means with salt water?
Yes, and it needs to go in through one nostril and come out of the other.
So you need that squishy bottle or that squid bottle to
or
do
a
that.
neti pot. So actually, nasal rinsing originated in ancient Ayurveda, like many centuries ago, and it was called Jal Neti.
Yes.
And it was quite common practice to be doing this, especially if there were gatherings or you met many people as a way of avoiding sickness.
Yeah.
So it's just about going back to those roots around that. Coming to the idea of nasal breathing practices, again, so common in our roots with yoga, right?
With pranayama, breathing exercises, everything, yes.
So the main aim around the breathing exercises needs to be that overall we are breathing too fast and too shallow. And we want to go into deeper, slower breathing. And it's not hyperventilation. It's actually the exact opposite of that because it's almost like silent breathing. But while I'm a big fan of Oxygen Advantage methods, there are books around this. There's a free app by Oxygen Advantage. There is lots of
What is it called?
It's called Oxygen Advantage.
Oxygen Advantage,
Yeah.
okay. And they have breathing exercises and everything if somebody wants to do it at home.
That,
Okay.
right. While I'm a fan of that, I would say if you can't do any of that, that's fine. Just practice your yoga pranayams, which are also easily available on YouTube, just single nostril breathing, humming. So the first one would be related to the nose. The second habit that I think is really important is to prioritize good quality sleep. The more tired we get, the more used to being tired we get, and therefore we put sleep on the back burner.
And how does a person know that it's a good quality sleep?
Let's just
Because
first
people
say-
think that, I slept fine.
Yeah.
But actually they're sleeping, but they don't have a restful sleep.
Right. So I would say that, in our 3 simple tricks, we will put it down to getting 8 hours of sleep. If I see a patient who has come to me because they're unrefreshed, they're snoring, they have sleep apnea, but at present they're only sleeping 5 hours, I also have to start rewinding that. So I'd say at least first let's prioritize good quality 8 hours of sleep. Quality will come later, first the quantity, then we can seek treatment. And the third aspect would be to actually use our jaws to chew food. So
Even if it hurts.
No.
If something. Then,
No, it shouldn't hurt because at that point, then we're already into joint pain or TMJ disease. Sorry.
Because to be honest, whenever because there was a long time, almost 5-6 years when I was vegan. And I think maybe it's because of that long gap or what, like even before I would never enjoyed steak or those kind of things. But if I have to, I feel like, it's hurting. I can't chew anymore.
Right. So start out
It maybe
slow.
shows a muscle weakness, I guess.
Muscle weakness, and sometimes there's muscle soreness because we are not breathing right, because we are grinding. We tend to carry a lot of tension in our jaw muscles, and this can be a disease which is called temporomandibular joint disorder, TMD we call it, which is usually not about the joint, it is about sore muscles. So pain while yawning, pain while trying to open and eat a big piece of sushi, or pain while chewing. Let's say if you're still vegan, but if you still need to chew like raw carrots
Even for
or broccoli
vegetables
or
you
nuts,
need, yes.
right? So everything should not be so cooked. So I would say these are the 3 things that are really helpful to health: chewing well, keeping our noses clean, and making sure that we get enough
Very
hours
simple.
of sleep.
Actually, all we need to do is just incorporate it in our lifestyle, right? So what do you do? 3, it could be spiritual hacks or any like overall health. It could be emotional, mental, spiritual, physical, that you feel everybody can do it at home. If you do that, just not only your oral health, but overall your healthy well-being, it's a must-do thing. As a doctor, as a dentist, as an 18 years experience with so many patients, that you feel this is what I do, or this can help to many people as well?
I exercise daily, which was not something that I did until 38 years of age.
Wow, you just started recently.
I started like 5 years ago, and I've been, intently at it daily. And while exercising, I make sure I nasal breathe. So this has been something that has really changed my muscle strength and therefore my sleep quality and my metabolic health. The other really good hack that I started doing is I got a sleep tracker, which is, we dentists are quite OCD people. We like everything to be perfect. So this gives me a score every morning. And when I start skimping back on my sleep, because I'm actually inherently a night owl, but the world is not made for night owls, especially
Yes.
if you have children. So you
Yes.
have to adapt around it. So I used to tend to skimp a lot on my sleep. Even till date, if I let go, I can come down to the 6.5
Especially when
hours.
you have work, you have home, you have children. It's not
And when you
easy.
run that Instagram, which,
Yeah.
calls out to you at night.
When you have too much on your plate, yes.
So I try to keep my scores in the 80s at least. So, having an
So
accountability.
score like over 80 is good score.
Yes, over 80, 85 is a good score around it. And I wouldn't say that everybody needs to have a sleep tracker, but I'm somebody who likes accountability.
Yeah,
So, there are others who happily switch off everything and go to bed at 10:30 and prioritize sleep perfectly. And I need that reminder to say it's bedtime now. I would say these, and yes, my last one, which I practice a little bit of mindfulness, which is not necessarily meditation. Sometimes with me, it's through prayer. And if I'm not praying, then I'll just kind of sit down.
Being present and, your mind is there, whatever you're doing.
Yeah. And these were my 3 hacks outside of breathing that I incorporated into life that have greatly helped me in the last few years, especially as age catches up with
Yes.
things.
But I feel breathing is something that all literally, without any exaggeration, every single guest who has come here, breathing is constant, that which every single person is saying means that there is something that we have been doing wrong all these years. And now people have started realizing the power of breathing, that you really don't need so much to be healthy. Just start breathing properly and, with full stability. And that's what I've experienced as well. Though I still struggle because I have allergic rhinitis. And even now while doing this podcast, I can feel that I'm constantly there's an obstruction there. I'm still struggling, but I feel a lot of difference by just doing the slow breathing in my tiredness level, in energy levels, and everything it is a miraculous thing, I feel.
Yeah.
You don't need too many things to be dependent on, right?
No, that's true. I had allergic rhinitis too.
I think
which
everyone
has
in
been-
Dubai has, I feel.
Yeah, and a lot of it is treatable.
Yes.
So
yes,
it's definitely solvable. We will help you with yours soon after.
But thank you so much for coming, for joining. It was quite an interesting and very informative, I would say. There are so many things, like the reason that I've called you here, because when I met you for the first time, I know that it's there. Like, I have struggled this. My daughter has struggled it. And we really overlooked how serious that issue was. So thank you so much. That was very, very informative.
Absolutely my pleasure. And I really hope it's helpful.
Thank you so much.
All
Thank
right.
you for joining
Thanks,
me in.
Zainab.